Hi, Kevin Henry of Dental Economics, and I'm here today at an IMTEC, Mini Dental Implants Seminar in Grapevine, Texas. And I'm here today with Dr. George Castro out of Sarasota, Florida. So you've got an Oklahoma guy and a Florida guy here in Texas learning about mini dental implants. Dr. Castro, you were telling me a little bit ago that you do implants in your practice, but this is the first time you've really been to a mini dental implant course.
Right. I started placing my own root form dental implants after I took a course sometime around 2003, 2004. And I came across a category of patients who wouldn't qualify for these standard size implants.
Okay.
And unfortunately, I didn't have an answer for denture stabilization other than maybe increased adhesive paste. But as I started reading more and more about the mini implants, I became more interested. Mm-hmm. I didn't jump in right away, and to be honest, what really turned my mind and made my decision to go into mini implants was an article in CR, clinical research that said that by Gordon Christensen, who said probably the time has come now for mini dental implants.
Okay. And was it one of those, whenever you read that, you said, okay, I want to check it out? Did you talk to other people? How did you what other steps did you maybe take to find out?
I did a combination of doing my own research on the internet, okay, on several systems, actually 3 in particular, and then I made some phone calls to colleagues in the local area to see what systems they were using.
Okay. And you and I were speaking a little bit earlier, and you said that you had actually talked to some oral surgeons in the area, and they had kind of maybe discounted the mini dental implant so far.
I have to admit that the oral surgeons that I was familiar with, that I am familiar with, presently don't place the mini dental implants, and I'm not sure if it's because they're not in favor of them. They think they're not scientifically based, but certainly the clinical success rate has borne out that these are, I think, are here to stay.
And I thought it was very cool, actually. You brought some panoramic x-rays here with you because you had some patients in mind that this might be a nice fit for.
Right. I brought in 2 panoramic x-rays, and I took them to the course lecturer, and Dr. Sawyer, who looked at one and said, "This one's great. This would be a great first case." And then he looked at the other and said, "This is not a good first case. In fact, this one is an extremely difficult case." And so I'm learning more and more about case selection now in this course.
So far you haven't placed one yet. That's coming later today, and you'll see that happen here on the video. But what have you heard so far that maybe surprised you a little bit, or made you a little bit maybe more curious about the placement?
I think everything is pretty much what I expected. Okay. Only one aspect that kind of surprised me was, in order to achieve bicortical stabilization, it's okay to perforate the maxillary sinus by about a millimeter or 2.
Okay. And what's the goal? Is this something that you feel like whenever you get back to Sarasota, you're going to be able to just run with whenever you get back to your practice?
I think I have a patient scheduled about a week or so from now, where I'll be doing 4 mini dental implants on mandibular arch.
Okay, very cool.
Yes. You got your tube pulled? A little bit further. Okay. Yeah. So the implants can hang in there, and we take it back on back to your seat. Oh, okay. Sherry, 2 implants.
10 millimeters would be about right.